It is now my true privilege to introduce a friend of mine, past president of this club, a past assistant district governor, Nancy Sclater.
Thank you, Tom. 5 years ago, our club, Seattle Rotary, celebrated its 100th anniversary. Also at that time, we launched our Second Century for Service project, a project to help us focus our efforts and expertise for the next 100 years, to solve significant and complicated problems, and to make an impact on the world in a way that only the powerful Rotary network can do. Our goal was to eradicate malaria. When we are successful, notice there's no hesitation about if, it's when we are successful. The eradication of malaria could be the most profound contribution to mankind. Malaria has haunted us since recorded history for over 500,000 years. And today, malaria is the world's most prolific killer. It is our goal to save lives, to ensure healthy people who are able to be educated and trained to be productive in the workforce. All of these efforts will be leading toward a more independent and a stronger Africa. Today, I'm going to give you a progress report on the accomplishments made during these past 5 years. Zambia was never on my bucket list to visit. But when I traveled there 5 years ago, the country and her people touched me in ways I could not have imagined. A few weeks ago, during an invocation, Roberta Nestis talked about a young boy named Joseph, who she met in a recent trip to Tanzania. I imagine that everyone who travels on a Rotary trip has a personal version of a Joseph, a child who symbolizes humanity in its simplest form and who radiates the effervescence of hope. I know I have certainly met many Josephs in my trips with Africa. And in these trips, while meeting these children, we were also able to plan and initiate our work. The bright eyes and the engaging smiles of these children are tremendous motivators as we pursue our programs. During the past 5 years, we have accomplished much against the deadly foe, malaria. We have launched 15 regional projects benefiting over 280,000 people, especially young children and pregnant women who are the most susceptible to succumb from this deadly disease. From global statistics, we know that we have prevented over 5,000 certain deaths and enabled countless others to continue to lead productive lives and not be debilitated by the ravages of this disease. Our project is creating a chain, a strong chain with reliable links, each building on the previous. Today, we now carry that chain into 3 countries, Zambia, Tanzania, and Uganda, all connected through Rotary's network, providing mutual support and expertise and a coordinated approach to our work. During the past 5 years, we have engaged 42 Rotary clubs internationally, working together on specific regional projects. We have invested more than $1,230,000 through the Rotary network and our ability to leverage funds. We have coordinated with other organizations who are also working in the regions, as well as local, regional, and national governments to ensure that our work is supported, coordinated, and will be sustained. We've even worked with the Lions Club in Uganda. These statistics are impressive and measure the success of our work, but more difficult to calibrate is the relationships that have developed around the world among Rotarians that span thousands of miles, differing cultures and religions, but who all share a commitment to service. As we travel for Rotary, we also have a lot of fun. We find ourselves in amazing parts of the world, For example, in a trip to Zambia, our member John Adams arranged for us to stay at a quaint beach resort where we convened to get over our jet lag and plan our engagement with the local Rotarians. We also experienced the Serengeti wildlife on a specially arranged safari. But the most meaningful part of our experiences is the hospitality of the local Rotarians, who treat us like royalty and also guide us as we work in their community. In remembering that Tanzanian beach, my thoughts quickly go to a kayak cruise. As Charley, Dickey, and I steered a kayak we shared toward the home base shore, all of a sudden, out of nowhere, a rogue wave upended us. Just as we were leading for shore, just as we were about ready to touch down, we exploded, much to the amusement of those watching on the shore. Regardless of what you might hear from Charley, I didn't do a thing. Honest, it just happened. And remember, you heard it from me first. So regardless of what Charley says, I am totally innocent. So with that as an introduction, let me bring Charley to the podium. Please welcome him as he describes his latest visit to Tanzania.
I can just, here. Well, thank you, Nancy. I've learned that it's a wise man who doesn't advise a woman how to drive. Well, 2 years ago, I ruptured my Achilles tendon. In one brief moment, summer plan A was done. But alas, just as I tossed my crutches, I heard from this floor about a plan B, a chance to explore Tanzania and witness this scourge called malaria, the one that I knew but didn't, the one that was not here but over there, and the one that impacts someone else but not me. Who would have thought that a bad day on a ski slope would be so transformative? So here I am, a couple of years later, brimming with telling signs of progress. Most importantly, that this club, in fact, your donation to the Seattle Rotary Service Foundation, has helped save 2,000 precious young lives, lives that otherwise would most certainly have been lost. So this is good work, but knowing that there are Rotary clubs in other needy Tanzanian communities, I know we can do more. Doing more was the object of our most recent trip to this country's Lake Victoria region, and to set the table for securing a global grant from Rotary International in 2015. A big shout out to Seattle 4's traveling mates of mine, Roberta Nestis and Fraser Thomas. First, to Dar es Salaam, where we met with senior USAID officials in the morning, and in the afternoon with the Tanzanian Malaria Program Director and his staff. The director has put the regional field officers at our disposal. Then we journeyed up country to reinforce and spread our mission. We flew to Mwanza at the bottom of Lake Victoria, where we were impressed by the zeal of members of an island-based Rotary Club. It is conceiving a project as I speak. And by the way, I made sure that there was a trail of well-placed Seahawk hats like this one to keep all of our new friends jazzed and connected. Then we hopped further north up to Bacoba. There, we checked in on this club's ongoing malaria treatment project, the project that exemplifies to others the difference we can make in relaxing malaria's grip on its easiest prey. On young children, just like this little girl with a big future who 2 days prior was at death's doorstep. And finally, we rocked and rolled our way up to Tanzania's far northwest corner to further be inspired by an extraordinarily spirited group of local Rotarians anxious to get on board our grant-creating effort. We met with the head of the regional health center, also a Rotarian, who knows firsthand the gaps our work can fill. Since our trip a month ago, progress. We recruited a very able Rotarian to serve as regional coordinator and keep this project moving forward. I believe also that the Rotary Club of Arusha, the gateway to the game parks, is aboard with a project idea of its own as well. Know that we're going back to Tanzania to advance more service work and meet more children whose lives were reclaimed by our efforts. And to do some more fun having as we did celebrating our last day of meeting lions and elephants. Hopefully it won't take an Achilles injury to steer your interest, but just the knowledge that if you do sign up, you too can make a difference. Lastly, as some of you know, 2 weeks ago, by a miraculous windfall of heavenly fortune, yes, I was able to meet Pope Francis personally. I mentioned to him that I was a Rotarian. I watched his eyes light up. As for the young, impoverished, malaria-stricken Tanzanians our work supports, I appealed for his prayers, which he promised. I interpret his response as nothing less than a call to action. President Tom?
There have been a lot of powerful Rotarians up at this podium today. You can see the level of service this club commits to. To continue the thought of service, our panel today will be led by Lisa Cohen. And Lisa is the Executive Director of the Washington Global Health Alliance, a coalition of the state's leading global health research and development organizations. Washington Global Health Alliance supports and advances Washington State's global health community as a nexus for research, education, training, and delivery on a world stage. WGHA membership includes global health organizations, educational institutions, and private and public entities. Won't you give a warm Seattle 4 welcome to our moderator today, Lisa Cohen.
Thank you, Tom, and I thank you so much for having us today. I'm not surprised at all by the devotion and dedication of this community and by you all in particular. We will all acknowledge here Rotary's astonishing role in helping combat polio as well as malaria today and the partnership that you afford. But the thing to me is that we live in such a compassionate community. We know that we are fortunate. It's a happy accident of where we were born and where we live and how we get to live our lives and what we take for granted at times. None of you are taking this for granted. None of you are taking this time of our lives and the importance that the great gifts that we've been given, and I really appreciate that. And it's been so inspiring to hear everyone today. So I want to thank you all for your efforts and to say you make me so proud to be part of this community. So thank you all. I am not going to go into deep introductions. We could be here until next Wednesday if I told you everything about what these esteemed panelists have accomplished. When Hamilton McCullough called me about doing this panel, we talked about whether it be one people or several, and there is, as you've heard from Nancy and others today, that it is a broad coalition that tackles malaria here, and we again are so fortunate in this community to have some of the leaders in this fight. So you're going to hear from these three. I also want to acknowledge there are many other organizations here as well, the University of Washington and Seattle Biomed, Infectious Disease Research Institute, and many others who are combating and tackling these global health scourges. But we have the stars here today, so I'm really excited. So just to my left is Dr. Alan Magill, and Alan heads the malaria program for the Bill and Melinda Gates Foundation. And I'm just so delighted that he could make the time to be here today. I happen to know that he was asked to be in a meeting with Bill and Melinda right at this time, and he chose to be here with us instead. So that's pretty cool, right? And I'm not going to go deep into bios. You can read about all these folks online. And next to him is Amie Batson, who's the Chief Strategy Officer at PATH. And PATH is doing astonishing things around the world. And I know you've heard from Steve Davis and others here before, but Amy's going to talk about their strategy as well. And then I know you all know your brother in arms here, David Owens, who's with World Vision and Vice President, Chief Development Officer, and to me, one of the most passionate advocates for taking action, taking any sort of action, doing something to improve the world and give back for the gifts we've been given. So let's welcome them all. Okay, so Alan, I'm going to start with you. A few years ago, Bill and Melinda put out an audacious goal to eradicate malaria, not just combat it, but eradicate it. Why malaria? Why now?
So, thanks, Lisa. I think to go back to 2007 when Bill and Melinda made the call for eradication, which was really quite a surprise to the community and almost heresy at the time. It's important to understand where that call came from, or just to remember where it came from, which is really about health equity. And it's, Melinda is saying, well, my children who grow up in Seattle don't have to worry about malaria, but children growing up in Zambia do. That just doesn't seem right. So it's really an equity issue, which drives the malaria agenda, as it does really all the agenda at the foundation. Secondly, there is an issue about malaria is different. And okay, I am a malariologist, so of course I would say that, but malaria is different and it's exceptional because when you look at malaria as a parasitic disease, biologically and technically this can be eradicated. Other great scourges like HIV/AIDS or tuberculosis, despite the havoc they wreak on our societies, are not eradicatable based on biology and technology. So it really does lend it to that. And then you really go, well, what's the final solution? And that really is the final solution, is to take malaria off the map.
So, Amie, malaria, the tackling of malaria is done on a number of fronts. PATH seems to be trying to address all of those. So can you talk a little bit about the work particularly you're doing in Zambia in partnership with Rotary and World Vision, and then how you're tackling this across those sectors?
Thank you, Lisa. So PATH is an NGO that's focused on transformative innovation to save the lives of women and children. And malaria is one of the biggest killers, particularly of children in Africa. So for us, it's become a central part of what we're doing. And we're tackling this malaria issue with partners such as Rotary. And the example of what's been done in Zambia with Rotary and a number of other kind of partners on the ground to make sure that we can really be driving their progress. It's exciting to see what can happen when there's a dedicated effort around malaria. And in fact, the example of malaria and the sort of 66% decline in the number of malaria cases and this other evidence of impact is partly what's now driving. It's the kind of the proof of, yes, we can start to move towards elimination. The Zambia is really one of the major proof points of it. How PATH is doing that in partnership is not only the work on the ground with partners like Rotary around the control strategies, but it's also about developing the new innovative tools that are going to help us get there. So we've been working on vaccines, on a more accurate diagnostic so that you can actually quickly diagnose if a child has it or has some other disease and needs to be treated in a different way. The kind of drugs and how do we stabilize the sort of critical inputs into the ACT drugs that are so important, and a variety of other kind of tools. And it's those type of tools that all come together with the work on the ground to make elimination and eradication something that we can actually achieve. So it's become such a major part of what PATH is doing that we just established a Malaria Center of Excellence, which pulls together all of the different groups in PATH, whether they be on the vaccine side, the diagnostic side, the drugs, the country control, our country teams, all together so that we are really capitalizing on that knowledge and know-how and making sure we're being the best partner in the efforts of everyone to eliminate malaria.
And that partnership piece is so critical, and Path is also overseeing the malaria vaccine initiative to pull together different ideas. I know we have a number of people from the Puget Sound Blood Center who are here today who work on cerebral malaria, which I didn't know until recently. So we've got all sorts of players in addition to what Jim's doing, and we need to know what's going on so we can share lessons learned as we go along. So that's just really critical. David, World Vision's work is on the ground. I mean, you are actually, you've got armies of people, literally, it seems, all over the world. Talk about what you're doing to control malaria.
Well, thank you. It's great to be with you here this noon. World Vision has a global footprint. We're at work in 100 countries around the world with a staff of 44,000. And I would say 95% to 99% of those individuals are serving in the countries in which they were born. So they know the language and the culture. And our work in malaria has been broad until our most recent initiatives over the last few years, where we really tried to focus on 5 countries with a 5-year strategy to protect 10 million people, with a particular emphasis on children, young children, and pregnant mothers, who are the most vulnerable to just the battle that is taking place with malaria. Focusing on 5 countries is part of our strategy. Another key pillar is collaboration, and you'll hear that a lot today if you haven't already. This is a team sport that we're playing. This is working together with many in order to get the job done, collaborating with local ministries of health at the national level, but then also international and global partners, as well as local partners and collaborators. Teaching and training. World Vision is particularly well equipped to be involved at the community level, working with community leaders and teachers to make a difference so that education around malaria and protection becomes real at the ground level, making sure that we're making those interventions that are needed, again, that are proven to be successful. And then I think there's another element, again, where our organizations cross over and assist each other, and that's in the area of health system strengthening and helping to equip and strengthen community health workers who are the front line in this battle against malaria.
You know, we hear, how many of you have heard the term health system strengthening before? Okay. How many of you really know what that means? I knew Steve would raise his hand, but okay. I mean, we talk about that. We all, you know, in any job or area of expertise, you know, we have our own language. And Alan, would you talk a little bit about system strengthening, what that means, and maybe you could use what we're learning from Ebola right now and how we see that very starkly.
Sure. So this is one view, and you know, health system strengthening is usually used when the health systems aren't doing a very good job, right? There's not very good functioning systems. This is often applied to public systems, and I think it's always interesting to challenge people to think about what they really mean by that, because look at the healthcare delivery system in the United States. It's big, broad, and every form of healthcare delivery one can imagine, from a purely 100% government-funded, government-delivered healthcare system, such as the VA system and such, to really very entrepreneurial medical care. So we have a delivery system in the United States. One could argue that it could be more efficient, but in reality it does deliver a vast array of very high-tech care to hundreds of millions of people. Then you go to Liberia or Guinea or Sierra Leone right now, the epicenter for the West African Ebola outbreak. Well, there really is no healthcare delivery system of any kind. And there is always an underneath sort of what we call a private system, which is really individuals literally, you know, selling small amounts of drugs in a corner drugstore. And when someone comes in and says they have an illness, they often get what we used to call a rally pack, which is 4 or 5 different kinds of drugs, several different colors of pills into a plastic bag, and that's your treatment. So there's a vast difference in healthcare delivery and expectations. And when we look at, you know, just the simple things, delivery of vaccines, antenatal care, there's a lot of very simple platforms where you make small investments and get huge returns. You can spend a vast amount of money on bone marrow transplants for leukemia, But really, that's a huge resource that only advanced and wealthy countries can afford, as opposed to delivering vaccines to hundreds of millions. I think it's a very complex topic, and what I usually resist is people say, well, we need to strengthen the healthcare systems. And I say, tell me exactly what you mean by that. What exactly do you mean? What's going to be done? Where's the money going to be spent? And really, a healthcare system that doesn't deliver in the public sector is usually just literally a symptom of bad governance, of poor and weak governments. And it's just one of many things wrong in those fragile states.
And that is something that I know that from our vantage point across the ocean, we can sometimes think, okay, corruption, lousy governments, and we can say, is my money going to be wasted? And but Amie, you had background at the World Bank and at AID. You know about the constraints of working within these governments and some of the challenges that they have. So help us understand a little bit more and about the opportunities for strengthening some of these health systems. Where would you focus? Where does PATH focus their efforts?
The issue of health strengthening gets very esoteric very quickly, frankly. And one of the best descriptions I've ever had of health systems is just saying it's about having the right trained health worker in the right place at the right time with the right tools so that when the person shows up, they can have their health intervention. And so when you look at each of those, right training, and having the tools to enable them to give a quality intervention in a cost-effective way becomes sort of one of those most critical elements. So for an organization like PATH, what we're looking at is those appropriate technologies, the really cost-effective, high-impact technologies that will enable a health worker who may only have 2 or 3 years of training and will be the only part of a health system that someone from a village will ever see. They will never see a nurse. They will never see a doctor in their life. There are millions of people who will only ever, if they are lucky, come into contact with a health worker level. And so empowering them with really simple tools like something like a diagnostic where you could have a simple prick of the finger, and it will show you right there, this person has X disease, and therefore you know what to do, is hugely empowering for a health worker to be able to provide a better treatment. Otherwise, what happens is a child comes presenting fever, and they're, do we just give them the malaria? Well, what if they have, pneumonia or some sort of diarrheal disease, and that's what's causing the fever? So it's that kind of tool that makes such a difference. Alan mentioned vaccines. I mean, vaccines are one of the miracles of the world. And for me, as a mother of 2, a vaccine is what enables me to go to my sort of pediatrician in downtown Seattle with everything possible available to treat my child. And for my child to have that same level of prevention that a mother who takes her child to a health hut in Senegal will receive. And it's because of the quality and the power of a vaccine and the prevention it provides. So it's those kind of tools that ultimately end up helping that despite extremely weak systems, despite sort of poor access to health workers and training, that people can still get a higher quality of care and that we can save millions of lives.
It's remarkable, actually, what is done with the limited resources that are there, that are often there. And the other thing that strikes me is you talk about getting immunizations for your kids. Here it's so ironic that here we are in the shadow of the Gates Foundation, PATH, World Vision, and others, that we have in this state some of the worst immunization rates in the country. And so that brings me to a point about education, which I know World Vision has been so focused on the ground education. I remember Bill Gates Sr. talking a few years ago about going to a village where bed nets had been distributed and asking a gentleman in the village, did he have a bed net? And the man said, absolutely, I have a bed net. And Mr. Gates said, can you show it to me? And the gentleman brought it out, still in its package, saying, here it is, very proudly. So there had been the dissemination of the technology of the intervention, but not the education. And David, can you talk about that component where the malaria interventions are concerned?
I'd love to. There's a real danger if a bed net stays in its package. It's not doing any good. It's also a problem if a bed net ends up being used as a fishing net or a wedding dress or all sorts of other purposes. Again, we're dealing with very creative and resourceful people. I think one of the things that has impressed me with the millions of nets that World Vision has been involved in distributing is a photograph that I've shared with a number of you and the Rotary Club here and elsewhere. And it's the picture of a guy wearing a tool belt with clearly hammers and nails, because the only good net is the one that gets installed. The only good net is the one that gets used properly. The only good net is the one that protects children and women when used properly during the evening. I think one of the things that's been so gratifying is that with a little bit of assistance, we've seen just dramatic change, dramatic impact, behavior change. We've also seen the community leaders step forward and actually call out the proper use of malaria prevention tools and medicines, as well as call out folks when they do use their bed net for a fishing net, and chastise and punish them for the misuse of that very important life-saving tool. I think that idea of education through teachers, through women's savings groups, has been just an incredible impact on the ground. And again, it's education and awareness, and then it's the prevention to stop transmission that is producing the kinds of results that we're so excited about.
So, Alan, we get hit up a lot, and all of you, we hear about all of the problems: HIV, TB, cancer, cholera, diarrheal disease, goes on, and it can feel we can feel a little helpless, right? It can feel overwhelming and helpless. So I'm going to go back and have you give a little bit more about why you think the investment in malaria now, talk about the progress that we've seen and why you're optimistic about it.
So I think one is on the sort of the value proposition. There are a lot of other very useful and needy things that could all demand our attention and resources. And I look at some things and I just call the repetitive delivery of healthcare services. So if you want healthy mothers and healthy babies, well, you can bet that every year there's a new cohort. This is an ongoing issue, right? If you want healthy babies, and what you really need is high-level obstetric care. So that's a health system, very horizontal platform. Malaria is different. It stands out, and we know that when you pull malaria out of a community, so many things get better. All-cause mortality drops far in excess of what you would see with just malaria. And it's the impact on the immune system, the impact on pneumococcal pneumonia, it's many other things. And then it's the productivity of the individuals. We tend to think of malaria as the acute disease, those sick kids that you see in the hospital. We now know that actually it's a chronic infection, and that if you're in a village in Uganda where literally 100% of the people are infected, you think that all of them are suffering from a chronic infection, and there's a productivity, a workforce and issue with all of that. So we think there's much greater benefit that can be seen by removing one of the most predominant infections around the world. And I think I forgot your second point, which was I'm
sorry, I was just listening to what you were saying and thinking about more questions about it. But
yeah, we'll go ahead.
The progress that we've seen over time, because I think that's important.
So the progress over time is very interesting. I started working in malaria in essentially the early 1990s, and I sort of figured out what malaria was by the late 1990s, right? So it takes a while. And then you realize in the late 1990s, we'd lost everything. We'd lost chloroquine, we'd lost SP to resistance. There were no bed nets being used. When you went out into Africa, it was the natural history of disease, really almost unimpeded. And it wasn't pretty. The late 1990s, mid and late 1990s, malaria, HIV, AIDS, this was pre-PEPFAR. It was a devastating time. Well, the community decided this was a humanitarian crisis. So the community made an intervention. We intervened, and when the tsunami hits Indonesia, what do? You send in the military, you send in everything you possibly can to actually end the dying. And that's what we did. We put out universal distribution of bed nets, we introduced ACTs, and we largely have completely bent the curve over the last 10 to 15 years. Massive reductions in deaths, massive reduction in cases. But now, as I say, we took off, we're flying the plane. The the crisis is over in many areas. You know, the last person that died in Western Kenya was in 2003, those kinds of things. But now we have to land the plane. And we don't actually know where the landing strip is. We're running out of gas. It's all the usual scenarios. Now, elimination is the airstrip. That's where we're going to land the plane. And that's where we end this forever, because 100 years of malaria history have shown us the resurgences that occur when you back off.
So that in these last few moments, I want to ask you each to tell me what's keeping you up at night around this issue. Amie?
What keeps me up at night, I guess it's the double-edged sword of, you know, what's exciting about malaria is this is going to be a worldwide joint effort. And one other African proverb to add to Sue's, which I think Rotary very much embodies, is this, this proverb of, if you want to go fast, go alone. If you want to go far, go together. And to achieve what Alan's been outlining in malaria, this is about really that long-term vision going together to achieve it. But that's also what keeps me up at night, that it requires that big effort of so many partners. And I think that the learning that Rotary has helped bring about how do you engage, you know, national leaders, community leaders, all partners to do it, to take this on and do their piece of it, is really remarkable. But it takes one chink in that chain to kind of create the challenges and the failures. So it's about how do we make sure that the human element is our strongest suit and not the civil unrest or other challenges that end up creating that, you know, we can't overcome it. We can't sort of achieve this global eradication goal.
Do I get to answer that question?
My mic's off. I think we're done. Okay, no, there we go.
I think I do get to answer the question.
Yes, you do, briefly, and then we're going to get to the good news.
Two things with malaria that keep me up at night, one of which is fatigue, distraction, and disruption. Again, we're dealing with very complex political and health systems in developing countries. The second thing that keeps me awake at night is drug and insecticide resistance, that we're dealing here with a limited set of tools. Some of them are very old, and through mutation we could find increased drug and insecticide resistance. So that gives me a sense of urgency as it relates to vaccine work and the other interventions.
I think that we need to keep an eye on the distractions as well. You know, we see what happened when we got a couple of cases of Ebola here, and somebody mentioned that we had Larry King's had 2.5 times more wives than we had cases of Ebola, but we got a little bit more attention to it. So, and I know from talking with Alan that his concern also is this drug resistance, but I want to end on the high notes, okay? So I want you to tell us what you're most excited about to leave people here walking out today with a sense of optimism.
Well, I would say that, and this is really core to the Rotarians' mission going forward on this, is really it's what I call the community engagement. I will guarantee you we'll know the moment the tide has turned when people wake up in villages and say, I don't have to live this way. I control my destiny with malaria. I don't wait on the government or some doctor to show up. I control this. What we've seen around the world is if you just put early access to treatment, you put a community health worker in a village with diagnostic tests and good treatments, and as soon as somebody has a fever, they show up and get treated, the dying stops, virtually almost within weeks, and the hospital is empty. And that has actually a tremendous effect on transmission reduction. So I would say that it isn't going to be a new vaccine or a new drug. It's the mental commitment of large numbers of people who just say, it's time. We did it with polio many years ago. We're doing it in the United States with polio. We're internationally today with polio. So I think it's that mental commitment, and I think Rotarians embody that better than anyone.
For me, it's the power of people. And it's that the world could take on this sort of shared goal that we don't have malaria in the United States, and yet that malaria elimination becomes a goal that we in America, that Europe, that Africa, that Asia, that everyone takes on this kind of collective commitment to do something that's going to benefit the whole world. And so for me, that's what's truly exciting and motivating.
Quickly, one of the most motivating moments for me was in the Kalalushi 2, the Rotary triggered project to combat malaria in the Copperbelt province of Zambia. A Rotary Club of less than 40 members, joined with 10 other partners, triggered 1,256 volunteers. That's about a 30-to-1 leverage point. 1,256 volunteers covered 2 huge communities and impacted the lives of 200,000 people. That's community engagement, that's mobilization, that's leadership, and that's service above self that Rotary stands for, and I want you to take that story with you today.
So I just want to thank all 3 of you for your service and all of you for your service, and thank you so much for having us here today. Thanks.
Thank you. Outstanding job. Thank you, Lisa, Alan, Amie, and David. Wasn't that a great presentation?
Seattle Rotary Online is made possible in part by a grant from First Choice Health, working with the Washington Health Information Collaborative to use technology to bring better health care to patients throughout the Pacific Northwest. First Choice Health.